telemedicine has taken root in the United States as one of the means of providing access to care to patients who otherwise would have had difficulty doing so. Today, we will be discussing this model of care more in-depthly. This is ReachMD, and I am your host, Dr. Renée Allen, and with me today is Dr. Latisha Rowe. Dr. Rowe is board certified in family medicine, and she also holds a Master of Business Administration from the Bauer College of Business. Dr. Rowe is also the founder of Click Clinic, a preeminent pioneer for telemedicine, providing patients with a new standard of care. Dr. Latisha Rowe, welcome to ReachMD.
Thank you. Thank you, Dr. Allen, for the kind introduction. It's my pleasure to be a part of this conversation today.
Today we will be discussing telemedicine issues and how this model of care positively impacts patients within the United States. Dr. Rowe, can you share your background in telemedicine? And for those of us who may not really know what telemedicine is all about, can you give us a definition of what is telemedicine?
First, my background. I am, as you mentioned, a family medicine physician, still practicing like many of your listeners today, seeing patients day to day, and I am also the founder of Click Clinic. I started doing telemedicine because I was burned out. I was working very long hours and spent a lot of time away from home, and I found that the lifestyle was not very good for me. I needed to practice medicine on my terms, and telemedicine allowed me to do so. Telemedicine, by definition, is any medical care provided through electronic means. So it is not limited to virtual consultations, which is what we do here at Click Clinic. If you have a phone call with a patient, an email with a patient, if you are receiving electronic data, whether cardiac monitoring or any data that is transmitted to us is considered telemedicine. So it is a very, very broad definition. But what we do at Click Clinic is virtual consultations for patients via video. We allow patients to choose their provider, and we encourage them to work with their existing provider whenever possible to get care they need on their terms.
Wow. Okay, Dr. Rowe. That is very informative, and I actually am quite intrigued with that. I actually want to know, tell me, you're doing virtual visits for these patients. Does this mean that telemedicine is safe?
Telemedicine is very safe. I use telemedicine. I encourage all of my family members and friends to do telemedicine because the truth of the matter is we have been doing telemedicine for many, many years, for decades. The only difference is now physicians are working smarter instead of harder, and we are getting reimbursed for what we have always done. Which physician or healthcare provider has not called in a medication for a patient? Going through the history over the phone when the patient is not able to come in, making the best assessment based on your medical knowledge and judgment, and doing what's in the best interest of the patient. That is telemedicine, and that is safe. We do not go beyond the scope of what is safe for the patient online. When employers ask, when should their employees use telemedicine, I tell them 100% of the time if it is not an emergency. Emergencies belong in the emergency room. Everything else should be screened initially by telemedicine and then follow up with the provider as needed. What that does for us as a whole, not just individually, patients and healthcare providers, is it lowers the cost for the entire system. Not everyone that is seen via telemedicine will be treated via telemedicine. There are times where we will have to refer back to the primary care provider for a hands-on visit. Now, if a primary care doctor or any physician is listening to this and feels threatened or that there may be competition by telemedicine, it is only threatening to your practice if you are not participating. If you are a participant, you are now increasing your revenue earning potential and sharing in what is a billion-dollar industry. It is the smart way to practice.
Dr. Rowe, you touched on a little bit earlier in your answer a statement about sometimes employers ask you when their employees should be accessing your services. So can you go into a little bit more in-depthly as to when should patients see a doctor online as opposed to seeing a doctor traditionally in the office, in the clinic?
So first, let me begin by saying everyone should see a doctor in person at least once per year. That's your annual physical exam. Click Clinic physicians believe in primary care. We believe everyone should be screened and have a physician that they identify with as their primary care provider. Once you have met that basic requirement and you are under the care of a physician, there are two reasons you're going to need to see the doctor for the most part. What we call chronic conditions or existing medical problems, or acute conditions, things that come up without any pre-existing reason. So, some examples, chronic conditions, many physicians listening in will know you see patients for hypertension, for diabetes, for heart disease, and you're simply getting updates on what has occurred and modifying the medications as needed. Those patients are stable, and that is something that you can do via telemedicine. And that is possible whether you're a primary care provider or a specialist. Many of our specialists can utilize telemedicine for their pre-surgical consults, pending that patient has been cleared physically by a primary care doctor. Acute things, sinus infections, urinary tract infections, ear infections are some of the most common things that we see. So almost everything that is non-emergent can be handled initially by telemedicine.
If you are just tuning in, you are listening to Reach MD, and I am your host, Dr. Renée Allen, and I am speaking with Dr. Latisha Rowe, founder of Click Clinic, a preeminent pioneer for telemedicine providing patients with a new standard of care. Dr. Rowe, can you give a little bit of more background on Click Clinic and why Click Clinic is different? And I do have to disclose here that I am a minority owner in this business.
Click Clinic is different because we are one of the few telemedicine companies. We are physician-owned, physician-operated. What that means for you as a patient is that you know our primary concern is truly your health and not profits. Many people, companies, corporations see telemedicine as just another way to make a profit. They have shown and proven their intentions by taking their companies public, and those that have not already, many plan to. Their concern is money. Our concern is preserving the relationship between the patient and the physician and making sure patients get access to physicians when they need it, where they need it, on their terms, and that our physicians are living healthy, happy lives and that they're not burned out. So the core of what makes us different really is our company culture and what we are about. It's not about making money. It's about putting technology in the hands of physicians so they can continue to do what they have always done, which is look out for the best interests of their patients.
Let's move on. I want you to discuss how corporations, what they can actually do to protect their employees if they do offer virtual visits.
I have spoken to many companies over the last year that have chosen their telemedicine company by default, meaning the company that they're using just happened to be the first company and the only company that ever approached them about telemedicine. Being that telemedicine is so new, these human resource directors and decision makers don't have a lot of information on how to choose the best company, or they don't realize that they have other options. So first and foremost, if you're going to select this benefit for your employees and your constituents, do your due diligence and consider multiple options. Do not go to the first company that approaches you, even if they seem to be a good choice, because when it comes to healthcare, you have to dig a little deeper. What do I mean by digging a little bit deeper? Look at the company's prescribing profile. If a company is prescribing antibiotics to your employees 99% of the time that they have a visit, chances are they're building antibiotic resistance within your constituents. That is not safe medicine. That's not good medicine, and it's not evidence-based medicine. So that is one thing. If you are working with an established telemedicine company, I would recommend that you ask, what is your prescribing profile? Beyond that, you need to look at the physicians. Are the physicians treating the patients qualified to do what they're doing? Do you have a podiatrist doing primary care? Unfortunately and sadly, that's something that happens. We at Click It Clinic utilize every specialty, but we make sure that physicians are actually practicing in the scope of what they were trained to do. So those are two of the top things that I would recommend that employers looking for a good telemedicine company look for and ask the right questions.
Thank you for listing those requirements. Why should the average physician offer virtual visits as opposed to choosing to stick with the traditional route of offering in-clinic and in-office care?
Because currently patients are going to retail clinics and urgent care for their care where they may not be receiving the best care because we as physicians are unavailable. When you open your mind to telemedicine and transform your practice from a traditional practice to what I like to call an integrative practice, traditional and virtual medicine, you give your patients more options. And why is it important for them to have more options? Because you know your patients. And every time a patient goes to a retail clinic or urgent care, they're going to see a new provider, and pieces of their history will be lost, things will be missed, and accidents will happen. Protect your patients by giving them access to you. Now, physicians, we do not expect you to work evenings and weekends. We know that you work hard enough already. So partner with Click It Clinic, who does not compete with you, to allow you to offer this to your patients without overextending yourself. If not Click It Clinic, you have to choose what is the best partner for you. But we truly believe that what we're doing by working with physicians, not competing against them, will prove to be not only beneficial to your patients, but beneficial to you and your practice as we show you how we can help you generate revenue even when you are not working.
Dr. Rowe, briefly, can you discuss what the danger in the corporate practice of medicine is today?
So I touched on it briefly before, but I'm so happy you asked that question because we really have to dig deep into the corporate practice of medicine. In Texas, the corporate practice of medicine is not allowed. Physicians have to be owners within clinics. There is a percentage that can be owned by non-physicians, but ultimately it allows physicians to be not only employees but owners. Why is that important? Why is it important that physicians have ownership and not just be employees? It's because we are truly committed to the outcomes of our patients and to the best interests of our patients. Business people are business people, and they are going to be concerned about profits. And profits and patient care often do not align. If we allow corporations to continue to take over healthcare entities and doctors to move away from being owners to employees, when it comes to profits versus patient care, ultimately profits will win. We are already seeing the trend that doctors are required to see patients in 15 minutes, 10 minutes. There are telemedicine companies interviewing doctors and telling them they should see the patient in 3 to 5 minutes. How can you be expected to provide good care under any circumstance in 3 to 5 minutes? That's what happens with the corporate practice of medicine. People stop thinking about the patient and they only think about the bottom line.
Now that we're nearing the end of the interview, is there any additional information that you'd like our ReachMD listeners to know about telemedicine and this model of care?
I would say to every listener, every healthcare provider, whether physician, nurse practitioner, physician assistant, if you are responsible for the care of a patient, it is your responsibility to know what is going on in this space. Telemedicine is growing very rapidly, and we control the pace. We control where it goes from here. We only do that if we are involved. If you need more information, if you're not sure where to start, if you're not sure how to get involved, email us, contact us. We are your advocates. We will show you, we will teach you that you do not need to have an MBA or a business degree to build your business. You are a business. Do not allow anyone to take that away from you. It's time to get on board, and it's time to get involved. Telemedicine is here today.
Many thanks to our guest, Dr. Latisha Rowe, founder of Click It Clinic and a preeminent pioneer in telemedicine, for joining us today. Thank you, Dr. Rowe.
You're very welcome. Thank you. It was an honor.
I am your host, Dr. Renée Allen. To download this podcast and others in this series, please visit reachmd.com. We encourage you to like, share, and comment on this episode. Thank you for listening to ReachMD. Be part of the knowledge.